The PSA blood test, prostatic specific antigen, is a blood test. It does not require you to fast when it's done. It would be smart to avoid sexual contact for 48 hours before the test is performed, because that will cause it to elevate. So that's critical. Understanding that the PSA is not 100% accurate test. Just realize that whatever tests we use are man-made tests looking for a God-given disease. The God-given diseases are a lot smarter than the man-made tests. So we are trying to find the secret of life and the code of how to keep us healthy. And even though this is not a great test, it is a good screening test to allow your information and your examination to be directed in a position that best gives the doctor the knowledge he needs to treat you appropriately. After the doctor's had a chance to examine you, order appropriate laboratory studies, and review the history, the information that you've provided to him, he'll usually come up with, if necessary, some form of prescription drugs to solve the problem that currently exists. And that's really what a prescription drug is designed to do. It's designed to make some little trade-offs in life to attain the goal of remaining, for lack of a better term, normal. With the understanding that nobody's normal, but to make our life functional and livable. Those prescription drugs are designed to get us out of trouble. Nutritional support is designed to keep us out of trouble and to avoid going down a path that eventually requires a prescription drug management. And that's why, with the changes in diet and the nutritional support being processed out for our prostate, that I think in today's world, unlike anything that happened 100 years ago, is that nutritional support is probably a reasonable approach, especially if our diet is not ideal, because we're eating on the run, we're eating processed foods, we're eating foods that have been hormonally or antibiotic manipulated, and we're not getting the diversity of food that we were originally designed to run on.